Welcome to Florida chapter of AAP Trainees Tips, an educational series for pediatric trainees offering advice on topics of interest identified by medical student, resident, and fellow members of the Florida chapter of the American Academy of Pediatrics. I am your host, Johanna, a third-year pediatric resident at the University of Florida, Jacksonville, Florida, and a member of the Florida chapter AAP residency and trainees committee. In this session of Florida chapter AAP trainees tips, we have Dr. Corinne Bria and Dr. Johanna Kielbasa of Nemours Children's Hospital in Orlando, Florida, will offer guidance on transitioning to intern leadership to help you understand the role, developmental skills, education, and communication of a strong intern leader in medicine, and take away a little caveat of how to grow in an intern leadership role. Dr. Bria is an associate professor of pediatric at University of Central Florida and a pediatric emergency medicine physician at Nemours Children's Hospital in Orlando, Florida. She has a master's degree in medical education and serves as associate program director for the general pediatric residency program at Nemours Children's Hospital. She is interested in building curricula for resident-based education, utilizing simulation, growing the advocacy program, and mentoring medical student and resident. She loves spending time with her husband and 4 children, group fitnessing, and long days at the beach. Dr. Kielbasa attended Wake Forest University for both medical school and residency, ultimately graduating in May 2011. Given her love of academic medicine, she moved across the country with her family to Oklahoma in order to start her educational career as a junior faculty at the University of Oklahoma from 2011 to 2017 as an assistant professor. Dr. Kielbasa came to Nemours in 2017 and is now an associate professor. She is a UCF medical student clerkship site director for Nemours. She is the director of education for NCH Division of Hospital Medicine. Dr. Kielbasa is one of 8 board-certified pediatric hospitalists at Nemours and is thrilled to be part of such an amazing and rapidly growing program, and is grateful for the continued support Nemours and UCF continue to provide her through her educational career. Now, I will turn it over to Dr. Bria and Dr. Kielbasa.
Thank you, Dr. Hanna, for that introduction again. For those of you that are just tuning in, we did a previous session on just kind of a general overview of leadership skills throughout residency, and this will be our session on transitioning into an intern, leadership roles that you can have for that transition to your intern leadership. So the very first thing, and kind of the most important thing I think in becoming an intern, is that you are the patient's doctor now. You're not just in training to become a doctor, you're officially a doctor. So own it, be proud of it, introduce yourself as doctor, and know that you are there to lead the family in their medical care. You're there as the family, the patient, and the family advocate. You're there to be the one who really helps the team understand what's going on with the patient and really should work hard to understand everything about them. The other goal is to just really be empathetic towards the family and patient and things that are going on with their hospitalization. That's just such a great sign of a good leader, is making sure that you can full picture kind of see what's going on with the patient. And then work on prioritizing your tasks with regard to patient care, which we'll talk more about later.
Those are such good places to start, especially as you are hitting the floors for the first time. One of the developmental skills that we want to talk about is self-awareness. Self-awareness and becoming more cognizant of yourself as a full person, as a complete person, involves developing your passions which are both professional and personal in nature. So when we think about your academic pursuits or your academic passions, you want these to be linked to your interest in medicine so that you can start to explore them further. It is totally fine to think that you want to pursue or that you want to learn more about one area of medicine and then completely realize that it is not for you and kind of do a turn on your heels and change directions. I always think to myself that it's very few things are a hard stop. A lot of times we can transition and we can bend as opposed to a full, complete, hard stop. The other thing that we think at this time is important is beginning to seek out mentorship. I like to think of mentorship as an active word. This is something that we want you to start looking at the senior residents, the attending physicians who you are interacting with. And we want you to start asking yourself, whose life do I want? Who do I want to be? And this will help to bring into focus more of the priorities in your life as you continue to develop.
Awesome. One of the next things that we really want to emphasize with everyone is your educational role as an intern. And one of the biggest things is to establish the expectations for students early on. So M3s and M4s, what are their goals? What do you expect of them? How do you expect them to present to you? How do you expect them to follow up with patient care, with families? What do you want them to prioritize in learning during their day? And then helping to organize the structure of the day and their efficiency kind of around what your expectations are. And at some point during the day, one of the most important things I think as an intern is what we like to call precision education. So really just trying to find tiny little, it's what you've heard about before. So teaching on the fly, learning as you go, quick little tidbits of real-time feedback. How can we adjust what you said? How can we tweak what you learned? Or how can we present what you learned in a different manner? Whether it's on the floor, whether it's in the ER, in the ICU, at the bedside, whatever it is, constantly trying to give little precise learning opportunities for those medical students is a huge help as an intern.
Agreed. Almost every moment is a learning opportunity, and so it's such a good idea to really be in those moments and bring that education to light. Communication is something that we are very passionate about. You will communicate and over-communicate every single day. And so when we think about communicating effectively, we thought it was really important to discuss a very grounded sort of definition of what is effective communication. So when we think of communicating effectively, we think about understanding our patients as completely as we can. So recognizing patterns, recognizing signs and symptoms, learning how the physical exam relates, taking into consideration additional imaging studies or laboratory studies, and synthesizing that information into as complete of a patient picture or a clinical picture as we can. And then we want to make sure that we're taking that synthesized information that we've worked so hard to put together, and we are asking appropriate questions of consultants. We are discussing important aspects of the case with our senior residents, with our attending physicians, with other members of our team, the medical students, and the other interns. And then we also want to make sure that as we're interacting with nurses, respiratory therapists, social workers, medics, that we're communicating effectively there as well. And so communication is going to continue to be a very important aspect of your life. And so we thought it was really important to have this touchdown conversation in terms of where to start.
Absolutely. And one of the things that we want to wrap up all the sessions with is just kind of a learning caveat, just kind of a highlight of things that hopefully you'll take from this going forward, but really important parts of being an intern, senior and or junior faculty. One of the biggest things as attendings that we come across is not owning your patient well enough. So it is your patient, you are their doctor, you are in charge of them, and own it. And be proud of it and be actively seeking out to learn more about them and know more about them. The more you learn about your patient, the better you'll be on rounds, the more you can pick up things that other people have missed. The more active you are in their healthcare, the better the outcomes for the patient as well. So own your patient, that's huge. The worst thing an attending can ever hear is that's not my patient. So even if you're cross-covering, even if it's a patient on a team you actually should know nothing about or do know nothing about, don't say to somebody, that's not my patient. It's oh my goodness, I'm so sorry. I have not been signed out on that patient. Let me go find out for you. And just be proactive in wanting to take care of people that are put in your life for you to be their physician. And then also be present for the entirety of the patient care. So including the difficult diagnoses and the difficult patient and family interaction. Again, we talk about often as attendings, you know, it's so easy as an intern to get bogged down in the minutia of the day that you have to run and do this, you have this lab to get in or this person to talk to or something else to do. But again, owning the whole patient and making sure that you're aware of everything that's going on with your patient at all times. So if there's a difficult diagnosis of cancer to give to a family or a sad diagnosis of this is end of life care, or you just have a really difficult parent or family member that, you know, you've had a rough day and you just don't feel like dealing with, instead of coming to an attending and saying, hey, I have to go do XYZ, could you please just go take care of that for me? I think the biggest, most important thing is for your education and for your ability to manage patients later in life and as an attending later, as a physician in charge of them, is be present. Be present and be actively involved. Go to those hard conversations, sit through those long, difficult hour-long meetings and learn as much as you can from all of that. So being an intern is fun. It's one of your first rungs on the leadership role of residency. It's something that probably you're not used to being thrown into and something that's different for you, but hopefully this little series will help kind of guide you along the way as you grow as a resident.
So we are so appreciative of you. We're so thankful that you joined us for the Florida chapter of the American Academy of Pediatrics Trainee Tips, and we will see you for our next session.
Thanks, guys.